So when we first heard about Partners in Healing, it was interesting to hear about. It seemed like it would take some weight off of the shoulders of the nurses, the CNAs, and help us to kind of take care of ourselves a little more, to get what we needed a little quicker maybe, and to save the simple things so that the nurses could do more important things.
Chase was born with a kidney disease, and it's kind of been something we've been dealing with. He got a kidney transplant a couple of years before we got married. We pretty much spent our first year of marriage in and out of hospitals. A couple months ago, he came down with a fever, and we took him to the ER. We found out he had an infection in his blood that latched onto his heart. So Chase ended up having to have open heart surgery at Intermountain Medical Center, and that's where we first heard about Partners in Healing.
My experience with teaching Chase and Tristan was the best, because what I caught on right away is that she was very attentive to everything I was doing when I was in her room. And when I saw that, I said, oh, here we go. This would be a perfect person I can invite to be my partner in healing, because she was so active in his care, asking all the right questions.
So when we were in the hospital, Christina, our nurse, taught me how to take care of him while we were there with things that I would eventually have to do at home. She taught me how to keep track of him on the breathing machine so that he could get his lungs to open up, how to help him cough into his heart pillow.
So being home has been a really smooth transition. My wife is really on top of things, like almost gets mad at me for not doing things like the breathing machine. Has really been on top of the meds, changing my IV, just really is confident in what she's doing.
She also taught me that, like, how to keep track of how many walks he went on throughout the day, and there are a lot of things that the nurses and the CNAs typically did that I was taught how to do when we were in the hospital, like where to get his snacks and where to get his drink and how to keep track of his fluid and his food intake, which is things that we had to do when we came home.
As we talked to them and we explained to them the little benefits of the use of the inspirometer, the importance of the anti-embolic stockings on every day, I think this will arm them with the confidence they need once they are home. We will invite you to participate in this program, and then you do what you can when you can while you're here.
It's really been nice and easy for me, helps me feel like I'm getting the care I need. I've been healing well, I feel comfortable, and it's just truly been great.